We have a team of researchers who have been using evidence-based techniques to source and synthesise the available guidance on COVID-19 and mental health. We are based at the Oxford Precision Psychiatry Lab, which is one of the key themes of the Oxford Health Biomedical Research Centre. And the team is comprised of myself. I am Dr. Catherine Smith, an honorary consultant psychiatrist, Dr. Edoardo Ostinelli, a specialty doctor, Orla MacDonald, who is our lead research pharmacist, and Professor Andrea Cipriani, who's also an honorary consultant psychiatrist and editor of Evidence-Based Mental Health. The synthesis of guidance that we've produced on COVID-19 and mental health is evidence-based because we systematically search all evidence across the UK, the US, Canada, Australia, New Zealand and Singapore, so all English-speaking countries. We then record which sources have been searched and which sources we've used, and then we update this regularly. The guidance is aimed at a variety of clinicians, particularly those in mental health, but that would include not only doctors but also nurses, those involved in research, pharmacists and managers, because the guidance covers all aspects of care, not just medication but social aspects, for example, managing care on inpatient wards, managing visitors and activities. It is relevant to all types of mental health care workers. In terms of choosing the questions that we address, this comes very much from clinicians. So the initial questions that we received were from senior clinicians within our trust who were faced with dilemmas that they weren't sure what to do with. As time has gone on and we've answered those initial questions rapidly, more and more questions have been asked, and they tend to focus on the areas within COVID and mental health, often where clinicians feel uncertain. So that might be the overlap between mental health and physical health, or mental health and social care. And those are the areas that we've focused on, at least initially, but we're expanding that week by week as more and more questions are submitted to us. In terms of competitors with our advice, I would say that the main other source of advice, particularly in the UK, comes from the Royal College of Psychiatrists. And I wouldn't say our guidance has been competing, it's definitely complementary. They've taken a slightly different approach where they've used the expertise of the college and the heads of their faculties to produce guidance which is very comprehensive and very detailed. So it really gives a wide and broad picture of the information. However, for those clinicians who want to get a focused and quick answer to their clinical question, our guidance is somewhat easier to use and more clinically focused, and it does have that evidence-based background to it which improves reliability. So in terms of keeping the guidance up to date, it's an ongoing task. So COVID-19 is a very rapidly progressing disease. It's almost unbelievable to think that it was only first described in December of last year, and within a few months it's already a global pandemic. So we have a programme of constantly updating each of the tables, which involves researching all of the original sources to check whether there have been updates, because as we know, in a global pandemic there are world updates on a daily basis, to make sure that the guidance keeps up to date. It's also an interactive platform, so we invite feedback from our users and they let us know as well whether there are any things that we might have missed, to keep the guidance up to date as possible. So we have a large number of translations which have been completed or are in progress, for example covering French, German, Turkish, Chinese, Italian and Japanese. And also our international collaborators have adapted our guidance so that it's locally relevant to the countries where they are disseminating it. And we've been careful to follow the range of medications which are covered by the WHO so that it's relevant in both developed and in developing countries as well.